Hello, it's CJ. Welcome to week 16 of your pregnancy. Today I'm going to talk about what's happening with your tiny human, some of the more common symptoms that you might be having, what you can do to help alleviate those symptoms. And if you stick around, I will tell you the 5 things that I recommend you do now that you're in your 16th week. I know at this point that your app is telling you that your baby is the same size as an avocado. That is because the apps continue to use a crown rump length, measuring from the top of the head to the bottom of the baby's booty. If you measured your baby from head to foot, however, he or she is now about 7.3 inches or 18.6 centimeters long and weighs 5.2 ounces or 146 grams. This week, the hearing is starting to develop. The hair follicles are starting to form, and the legs are now longer than the arms. Your baby's heart continues to beat 120 to 160 times per minute. An interesting little fun fact, that heart is pumping about 25 quarts of blood every single day. So what are some of the more common symptoms that you can expect? Number 1, round ligament pain. Every time you make a sudden movement, sneezing, laughing, coughing, rolling over in bed, you can get a pulling sensation down deep in your pelvis, and it can take your breath away. The good news is it's perfectly normal. What can you do to prevent round ligament pain? If you know you're going to be making a sudden movement, hug your tummy. Number 2, gas or bloating. That is because all of the progesterone being produced by your placenta. Some things that you can do to help with that: eat small, frequent meals, avoid carbonated beverages, and try to take a brisk walk after you finish eating. Number 3, lower back discomfort. That's because your uterus is growing, putting pressure on that lower back. So what are some things you can do to help? Stretching exercises, yoga, prenatal massage, a nice warm bath. Number 4, forgetfulness, also known as pregnancy brain. If you are having stress, anxiety, or not getting a lot of sleep at night, it can make it much worse. I recommend trying to keep it simple and make a lot of lists. And number 5, depending on where your placenta is located, what number baby this is for you, and how many babies you're carrying, you might be starting to feel those little flutters. If this is your first baby or you have an anterior placenta, you may not be feeling movement yet, and that's okay. So what should you be doing in the 16th week of your pregnancy? Number 1, if you have not taken a picture of your baby bump recently, I recommend you do that. Number 2, switch to more comfortable shoes, ideally something without a heel. Number 3, try to stay active. Swimming, prenatal yoga, walking are all great exercises. That being said, it's probably also a good idea to avoid anything that could cause harm to you or your baby, such as kickboxing, downhill skiing, horseback riding, or amusement rides. Number 4, decide whether or not you want to have an alpha fetal protein or quad screen done at your next prenatal visit. That is a time-sensitive test that has to be done between 15 and 20 weeks. The purpose of that test is to see if your baby is at increased risk to have a neural tube defect, such as spina bifida. And finally, number 5, I do hope that you're writing down all of the questions that you and your partner have in anticipation of your next prenatal visit. In the meantime, if there are any questions at all that I can answer for you, I hope you'll let me know in the comment section below. And while you're in that comment section, I would also really appreciate it if you'd hit the like button, or feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.